If you have hip pain, today I'm going to teach you 4 incredible stretches that will help you relieve the pain and reduce muscle tension. We're going to stretch the 4 walls of the hip: the inner wall, the adductor muscles, the posterior wall, the gluteal muscles, and especially the deep level rotators of the joint. Then we're going to stretch the psoas muscles, right here in front, a very powerful muscle that runs at a deep level. And then we're going to finish with the stretching of the tensor fasciae latae. Very good for all of you who have lateral hip pain or trochanteritis. But before we start, I want to remind you that next week an amazing event about the hip called Hip Week will take place from the 21st to the 27th of April. Let's start with the first stretch, stretching the inner hip muscles, adductors, as we just said. For this, I want you to sit on the floor and place your feet in front of you so they can touch each other. Be cautious as everyone here is flexible. Different. If you find it very difficult to support your feet together and relax your knees, or it causes pain, I invite you to separate them a little more and take them a little further away. The further we take those feet, the easier the exercise will be. The closer we have them, the harder the exercise will be. So start at a distance where you are comfortable. Comfort is important. We always have to start from a painless position, feet supported by each other, as you can see here. Camera up, knees that we let fall down, they don't need to touch the ground. If it's uncomfortable, we could even place a couple of cushions down here to hold them. I grab my feet with my hands, and all I do here is bring my torso, my chest down. I don't want to bend too much. I don't want that hump, that hunchback to come out. What I want is to bring that thorax up so that the movement occurs at the level of the pelvis. And don't strain at the level of the adductors, that is right here on the inner part of our hip. You don't need to feel a great tension. It can be between 0 and 10. 0, absence of tension. 10, maximum tension. A level of 3-4 would be more than adequate. So we're going to lean forward, lift our chest up, and hold that position for 30 seconds. Then we evaluate and increase the difficulty. Instead of counting, we'll do it with breaths, which is usually more bearable and pleasant. I'm going to take a breath. And as I release, I apply pressure to the movement and try to bring my chest towards my feet. We will do 5 breaths together. I'll inhale first. We release. And I approach my feet, increasing that tightness too. I take a breath. We release. 3. We only have 2 left. Remember to work within your capabilities and not to hunch too much forward. We release. 4. Last one. I let go and approach. Very, very good. How are the feelings? Good? Bad? If it has been too easy, we can bring those feet a little closer to us, thus increasing the intensity. Feet supported on each other, knees drop down. You don't need them to reach the ground. Mine don't reach. If it causes pain, you could place a small cushion to support those 2 knees. And so we're going to do 5 more. Okay? I want you to take a breath, and as you release, now bring your chest down. Now the stretch is much more pronounced. You're going to feel it well at the level of the adductor. Let me change the camera here, right at the level of the adductor. However, it has to be a tolerable tension. Don't overdo the intensity. That's not what we're looking for. 2 up. We hunch over. We let go. 1. We let go, and our arms help us lean forward. 2. The tension here is greater. It's more localized. 2. 3. And I'm tolerating greater stretching sensations. Around 4, 5, or even 6. And we release. Last repetition, I take a breath, I get right straight, I let go. And 5. I don't know how much we've counted, but I think that makes 5. We relax our feet a bit. Reposition our feet on the ground, close our eyes. Feel that internal relaxation at the level of the inner edge of our thighs. And now we're going to move to the back level of those hip rotators, which are especially here at the deep level of our pelvis. For this, I want you to move a little bit forward and lie down on your back. We're going to put this here so you can follow me better. From here, we're going to start with the left leg. I want you to cross your left leg in such a way that the ankle of my left leg lets the camera switch. So you can see it well, it's in contact with the thigh. My ankle here is touching my thigh. From this position, we have a first variant, in which we are going to take our leg, which is in contact with the ground, and carry those two thighs towards the chest. This inherently is going to produce an external rotation of our left leg and therefore a tightness at a deep level of the buttock. I'll turn on the side camera for a better view. I introduce my hands, one inside, another outside, place those hands around my thigh and blind towards me, and maintain that position for 30 seconds or 5 breaths. If it's not hard for you, if you have a little belly and it's hard for you to grab that thigh, it's okay. You can use a blanket like the one I have here. I put the blanket through here, one on each side. Let me show you. This is how I'm putting the blanket so that one end is on each side. Next, I position myself in the same position, same legs, and pull with my arms. More comfortable, right? A little less intense, but also very effective. And we're going to do 4 breaths, otherwise it's going to be too long. I take a breath. And as I release, I try to bring those 2 knees to my chest. If it goes up on the right, it also goes up on the left. I take a breath. And release. Very good tightness at the buttock level. 2, I take a breath. And we release. I have 1 left. I take a breath down. And we release. Great, but we're not done yet. Let's give those deep rotators some additional stretching exercises. Pay close attention. What I want you to do now is to rotate in such a way that the foot we had resting on the thigh is resting on the floor. Pay close attention to the lateral plane and pay close attention to the superior plane. I lie down on my side, okay? So my right shoulder, that comes supported, the legs do not change position. What you need to pay attention to here is the foot. This foot is going to greatly modify the sensations you feel in your hip, okay? So, if there's a very intense stretch or not intense enough, I encourage you to change that foot position to better direct the stretch and have better sensations. What I want from here is to bring that knee towards my right shoulder. Here, for example, I have very little tightness at the level of my buttock, so I'm going to take that foot a little further out and a little higher to give it more tightness. I lower that knee and push it with my right hand. With my left hand, I can change the foot a little bit more here, and what I'm looking for is tightness at the level of my buttock. I'm already noticing it here. Hold the position for 3 to 4 breaths. I in fact recommend you to place one hand on the foot, because sometimes the foot slips and the opposite hand, here at the level of your knee, so that we can properly direct that tension, work well that musculature at a deep level of the hip. Here you are going to need a little more work to try to work, placing that foot in different positions until you find that posture that causes you the most tension. And what can also help you increase the tension is to stretch the leg down, but I don't like it as much as it alters the pelvis position. We're going to hold this position for 4 quick breaths. Each time we release, I bring that right knee more towards the right number 1. No. 1, 2, 3. And 4. Again, if this is too intense or uncomfortable, we have the whole previous variant, in which we cross the leg, we stretch the left leg, now we are going to stretch the right leg. I place it, I cross it, my ankle stays in contact with that thigh, and from here we have 2 options, either the blanket or the arms. I carry it there strongly, feeling tightness here in all my right buttock. Very pleasant, and I hold the position for 4 breaths. We take a breath, and when we release, we give it a little more tension. Very good, very pleasant. When we release. 2. We release. 3. Last. We release. and 4. And from here, my body rotates to the opposite side. My foot touches the ground. Let's see if we can see it from there. This foot is touching the ground. I can adjust its position based on my preference. With my other hand, I hold it. That knee towards the left shoulder. Notice that I feel more tension on this side than on the opposite side. Remember, my right hand is on the knee and my left hand holds the foot in place, okay? And from here we are going to do, 4 quick breaths before moving on to the next. We take a breath, let go, support well. That knee, I bring it towards the opposite shoulder. Very, very pleasant tightness here at the buttock level. 1-1. We release. 2. We release. 3. Last one. We return slowly to the initial position, lying on our backs. We rest our feet on the ground. We close our eyes a bit to feel muscle sensations. As these stretches have largely managed to release muscle tension, we take this blanket again, and now we are going to stretch the left leg. The tensor of the fascia lata, especially designed for those of you who have outer pain next to the trochanter when you are supported, for example, in bed or lying on your side. From this position, I want you to place your legs completely stretched out, your knee completely stretched out. What I'm looking for is to stretch, to separate my outer edge of the hip from my foot, and for that I'm going to try to do the following. Okay, take my hip to the maximum outward, here, until I start to feel tightness here on my outer lateral edge. This is going to depend a lot on the tightness, the flexibility that each one of you has. Knee stretched, I take that tip outwards, crossing the leg, crossing my buttock. It can come off without any problem, and it's here that I start to notice some tightness. I stay here, be careful, because it's not a tightness we're used to. It's not the typical muscle tightness, but it's going to be a little unpleasant, a little electric, a slightly different sensation. Don't be alarmed, it's completely normal. It's what happens when you stretch these types of muscles. Knee fully extended, left buttock lifted. My shoulders are still as close to the ground as possible, both the right shoulder and the left shoulder. This allows me to apply a certain rotation and focus the stretch where I want, and there I hold. We've been at it for 20 seconds, let's continue for 10 more without taking breaths. And then I'm going to show you with the opposite leg so you don't miss a bit of how to do it. Notice that my buttock is detached. You don't need to go very far to the ground, even touch the ground, or get your leg super far away. But we have to try to keep the torso as close to the ground as possible. We lift that buttock, and there will come a time when you will start to feel tightness on that lateral edge. That's exactly where we have to hold the position. We're going to switch sides just to show you well with the right leg and so you have another point of view. I hook that foot again at the level of the blanket, leg completely stretched. Both legs are placed completely stretched. And from here what I do is rotate. My right shoulder tries to stay back, glued to the floor. My right buttock lifts off. Let me show you again. It can be hard to see from home. I'm going to lift up a little bit. My right shoulder stays glued down on the floor. My right buttock lifts off. My right knee is well stretched, and I turn up to here. I start to feel some tightness, so I stay here. I try to insist more, stick that shoulder back more and maintain the position while I feel that tightness. On the lateral edge of my leg. We're going to put this camera right in front so you can see it. Lateral edge of my leg. My right buttock is lifted. My shoulders remain in contact with the ground. We're going to take 4 breaths. Now we let go. We take a breath, and with each exhalation, we try to go a little bit further, give it a little more tension. 2. We release. 3. Last repetition. We release. 4. Very good. Slowly we return to the initial position. Remember that this stretch may feel a little different. Even a certain point of tingling, numbness is completely normal. You're not going to notice it as much as, for example, the exercise we've seen with the deep glute muscles, and we're going to finish with the pigeon exercise, a quite complicated exercise, but one that I want to teach you, and that can be very useful if you manage to master it. First, get on all fours. From here, I choose one of the legs, left leg, I move it a little bit forward, and the right leg, I stretch it back until the tip is resting on the ground. Pay close attention, because now I'm going to pivot with my left leg. If it was here, I take it out so that it lies flat on the ground. And little by little, I lower my right knee until it touches the ground. My leg is flat. I can place either the tip or the forefoot, whatever you want, like the instep. And from here, little by little, I try to lower my pelvis down, keep lowering it, sliding that leg back. I keep going down, I keep going down until I find a comfortable position. There will be different points of tension here. Can we feel tension at the level of the left buttock of this leg that I have here? Or can we also feel tension at the level of the right psoas, which is the muscle that we really want to stretch with this movement, which is very deep and is located in front of our pelvis. Place your hands in front, close your eyes, and stretch as much as possible upwards. By doing this, I assure you that you will notice a great tightness here at the level of the psoas. To make this exercise completely effective, and little by little, you lower yourself a little more, the pelvis. Each time it goes down more, you get comfortable more and more. And again, we try to stand more upright. That's it. And we're going to take 4 breaths here, really feeling the stretch in the entire quadrant, the right flank, at the level of the abdomen. We take a breath, and as we release, I stretch upwards and push out my chest as much as possible. We're going to switch cameras, otherwise it cuts me off. If you can tilt your head back, that's even better. We take a breath, relax, release, support with arms, and up. Right, white, very well stretched. 2 last ones. We release. Last repetition. We release. Very good. To get out of here slowly, I support my hands. I go back picking up that right knee. I pick it up and little by little I reposition my left leg. We would be in the same position, having done the right side. Close your eyes and feel your muscles to see how the pelvis is positioned. The hip in front of the right side is completely relaxed compared to the left side. So, we are going to do the same with the left side. Not before raising that camera a little bit so my head doesn't get cut off. Here we are again in quadruped. Now I want to stretch my left leg, so I'm going to bring my right leg forward, stretch my opposite leg behind. Rotate. Remember, I'm going to put everything from above, rotate my leg until it lies down on the floor, and from here I'm going to sit back. At the same time that my knee is here, it slides little by little, and my pelvis goes down more and more. It looks much better here, doesn't it? Go down more, until I notice that either my pants are going to burst or my body can't take it anymore. From there, what we're going to do is place our hands on the ground. You can place with fists to work more on that extension. And I'm going to take my head and back as far back as possible. Tightness here. This is what we need to notice, the left abdomen, which is what we're going to open upwards. We take a breath from this position, and as we release, we lift the chest as much as possible, and tilt your head back as if you want to look at the ceiling. This ensures that there is a great deal of tension. It creates a great synergy at the level of your lumbar spine, which is really involved in that psoas muscle. We take a breath, relax, let go, and go up. New. 2, 3. And 4. Extremely pleasant to get out of here. Very slowly. We pick up the right knee. Notice how I pick it up. The left knee. Then I rotate my right leg, and I'm back on all fours again. And again we pause for a moment to enjoy the good results of these stretches. Impressive. Especially the last one. It may not be suitable for everyone, but you have 3 very good initial stretches. And you can try this last one. And if it's too difficult, leave it completely aside. I remind you of our event next week, the Hip Week, an impressive event. You'll learn a lot of information and exercises like these, with variations, so you can work. The 3 indispensable pillars in your hip pain recovery are movement, strength, and stability. To sign up, as you know, you have the link in the description or in the first comment, and it's completely free. That's all. I thank you from the bottom of my heart for accompanying me to the end of the video, and I hope you can share it with all those people who have hip pain, since these stretching and mobility exercises could be the small key, the small flame that ignites the fuse of improvement. Greetings, and I hope to see you again very soon. Remove day 21 in the Hip Week. Bye, friends.